Hello everybody, my name is Alexandria Armach and I am currently in the Masters of Health Administration program at the University of St. Augustine for Health Sciences. This presentation today is an evidence-based practice change project, and my topic is combining Western and alternative medicine when working with patients who have PCOS, so polycystic ovarian syndrome. So my outline for this presentation is the problem and background, my PICO question, the systematic literature search, the evidence I found, and then the change process I want to implement, and then database evaluation, dissemination, and then finally conclusions with my practice recommendation. So before we dive deep into my presentation, I just wanted to give a little background on the topics I will be discussing. So an alternative medicine physician, you might know them as a naturopathic physician. Their main focus is prevention and a holistic treatment. They do combine traditional and Western methods, and then they do use homeopathy, herbology, acupuncture, massage, and holistic wellness. And that is all from the American Institute of Alternative Medicine. And then the hormones I'll be looking at, luteinizing hormone and follicle-stimulating hormone. Those hormones stimulate your gonads. They play a significant role in the development and release of eggs from the ovary. And then the normal ratio to LH and FSH is 1:1. And then people with PCOS, they have an elevated ratio, either 2:1 or 3:1. And this is all from Insulate Health PCOS. So a little bit about the problem and background. There's a gap in research for women's health to begin with, and LaGroix in 2019 talks about how the prevention and treatment of PCOS, there's not much research on that as well, but at the same time there's an interest from the population of women who do have it. They want to know, why are they getting treated this way? Why aren't they seeing that much improvement with their symptoms they have? And Raquel in 2016 said that women are not getting diagnosed early enough, so that is causing other problems to happen later in their life. And then Harrington and others in 2021 said typical treatments are causing other issues. So my main question, why are we doing it this way? Being in administration, I want to help lead organizations that are there for their patients. I want to listen to their symptoms, and I want to get down to the root cause, because we are just masking their problems right now, giving them the traditional treatments. And we really need to get to know why they're having these symptoms, causing them to have PCOS. So here you can see my PICO question. Do women with PCOS have normal levels of luteinizing and follicle-stimulating hormones working with an alternative medicine doctor compared to just being prescribed birth control and other medications by a traditional physician? When I started my systematic literature search, some keywords I did was birth control, oral contraceptive pills, PCOS or polycystic ovary syndrome, traditional medicine, functional medicine, holistic medicine, and alternative medicine, and hormone, the plural version, and luteinizing hormone or LH, and follicle stimulating hormone, or the abbreviation as well. My inclusion criteria include English as the only language. I wanted them to be original or systematic reviews. They had to be within the past 5 years, academic journals, women as the population, and then have a focus of imbalance of LH and FSH hormones, and then it had to be evidence-based healthcare. My exclusion criteria was the male population, woman not on birth control. If it was older than 5 years, I excluded it. If they were animal studies or if they were IVF studies. And then the databases I used include ProQuest, Web of Science, and National Library of Medicine. So here you can see my Prisma model, which I was able to create after inserting all of my criteria for my systematic search. And towards the beginning of my search, you can see that I had 140 studies, and after taking out duplications and adding all of my criteria, I ended up with 6 studies for my systematic literature search. So when talking about the evidence from my sources, the traditional treatments and involved risks was the main topic. Metformin and oral contraceptive pills are the first line of defense for PCOS patients, but they are still not fully recovering. Arndt and others in 2017 said that treatments are also not addressing all symptoms for patients. And then Arndt, Hugh, Kadura, and Sebastio all say that these traditional treatments can lead to other health complications, including cardiovascular disease, hypertension, deep vein thrombosis, thrombosis, and metformin can actually cause adverse effects for fertility. And then there's a lack of evidence. All of the studies mention the lack of evidence for PCOS and the importance of upcoming research for it with alternative medicine, which is very exciting. And then type of data collected. I did this as a main idea because of the lack of PCOS etiology. Even if the articles did not mention the hormones I am talking about in my PICO question, they collected other data related to women's reproductive system. And then variety of alternative treatments. Just to name some examples, Arntz and others in 2017 did their study with 2 herbal tablets that had a variety of plants within them. And then Z and others in 2019 used berberine, which is a derivative from a plant. And then finally, Sebastio and others in 2018 used the supplements of calcium and vitamin D. And then finally, the interprofessional collaboration. Only 2 studies focused on the collaboration of Western and alternative medicine, the berberine and vitamin D and calcium. The remaining focused on the gaps in research and what other research needs to be done, so this can be used in the clinical field. And then for my sort level, I did my sort for my recommendations at a level 1, and I did this because my sources included RCTs and they had validated clinical decision making. So for this project, I would start with implementing it in my OBGYN office I work at in Grand Rapids, Michigan. I chose the model of Coder and Cohen because the first part is about urgency, which is consistent with my personal cognitive processes, and I also have an emotional connection to this EBP change, which is the final part of this model. So to create a sense of urgency, I would ask providers how many patients have recurrent office visits for PCOS with no improvement. I could also ask if patients are making additional appointments to switch treatments due to this problem. This shows an urgency for this collaboration so that we are asking our patients how the issue started instead of what symptoms are just currently bothering them at the moment. And then with the hormones, fertility is the conversation. So we need to make sure we have the appropriate treatment plan for the patients. I would form a powerful coalition with my clinical managers because of their connections they have, which then can expand my project to policyholders and the board of trustees. I would also like to gain insight from the nurses and administration staff. It will be easy to create the vision because of the emotional attachment of infertility with PCOS patients. I could create surveys for communicating this vision. This would help implement the changes because we can hear patients' preferences and create data from it. And then empowering others would involve training and education in alternative medicine, and this can be done in a variety of ways. We could start with blog posts in alternative medicine and treating PCOS, just little things that go into coworkers' emails that they can read throughout their day. And I could also conduct meetings with alternative physicians with the office so they can collaborate in person. And then for creating the short-term wins, my office has monthly meetings, so making a short-term goal at each meeting would be reasonable. For example, creating surveys for patients and staff about how they feel after the change is implemented. Consolidating improvements could include collecting data from after-visit surveys that we send to patients. And we already do these surveys. They go out to the patients after they're seen, so we can just add simple questions like, how do you feel about the new providers if they do see the alternative medicine physician? And then that data can be used and we could produce more change by communicating our results with other offices. And then finally, new approaches would include expanding this change to other cities in Michigan. So for my database evaluation, what I am measuring, I'm measuring the hormones LH and FSH of PCOS patients after working with the alternative medicine doctor. How I am measuring it, the Rotterdam criteria. It is shown in the Arts and Others article in 2017 to confirm the PCOS diagnosis. And then the LH and FSH hormone levels are measured through a laboratory, according to Kadura and others in 2019. And then groups I'm measuring female patients between the ages of 18 and 44, according to Allegro and others in 2013. And then when I am measuring it, I will access the patients before the project with the Rotterdam criteria, and then measure their hormone levels at the start of the project during their early follicular phase of their menstrual cycle, and then 3 months later. And then who is measuring this? I'll have the physicians make sure the PCOS patients pass the Rotterdam criteria, and the laboratory will report the hormone levels. Continuing on with the identification of dependent outcome variables and the level of measurement, the Rotterdam criteria is ordinal because it has 3 criteria points, and patients must have 2 of them, and the patients can be grouped after the results. And then the hormone levels fall underneath the ratio scale because these levels do not fall below 0, and then descriptive and inferential statistics may be calculated. And then for the test, the Wilcoxon-signed rank test will be used for comparing before and after the treatment, the 3-month mark. And then standard mean difference, confidence interval, and Cochrane's Q test can be used. And for dissemination, we can look at it at an institutional, local, and national level. At an institutional, can do it with company emails and newsletters, collaborative change meetings, which I mentioned earlier, and LinkedIn posts. At a local level, I could share it at Grand Rapids Fertility and Women Health Centers or at alternative medicine offices. And then at a national venue, poster presentations and publications could be done through the Institute for Women's Health, the American College of Obstetricians and Gynecologists, or the National Center for Complementary and Integrative Health, and finally the American College of Healthcare Executives. For my practice recommendation, I have a strong consistency between my sources, and the studies actually go beyond my PCO question because of the variety of data they collected. And this hump that we need to get over is breaking the status quo of only using traditional Western medicine for treating PCOS patients. Overall, my recommendation is alternative medicine shows promise for the future practice of interprofessional care when working with PCOS patients, especially when leveling their LH and FSH hormones. Collaborating Western and alternative treatments, we are one step forward with decreasing infertility worldwide. Arndt and others in 2017 mentioned that a survey of 657 women with PCOS showed that they desire alternative treatment in conjunction with the traditional treatment or without it. For the strength of my recommendation, I believe it is a B. I believe this to be true because of the studies not focusing on all parts of my PCO question, and one study focused on medicine from a book rather than doing a clinical trial. But overall, there's a low quantity of the studies as well, so that's why I made it a B instead of an A. But this shows promise that there's a future for the practice of interprofessional care with PCOS patients and their LH and FSH hormone levels. So in summary, PCOS patients deserve more answers to their disorder. We need to do more than hand out pills that are masking their symptoms. We need to figure out what hormones are not in balance and figure out ways to balance those once again. The evidence shows that herbal treatment alone or in combination with the traditional methods improves women's LH and FSH levels, which can play a huge role in one's fertility. This EBP change is not meant to ditch traditional methods completely because many women enjoy the improved symptoms from the traditional medicine. This project is just meant to show women the truth behind these treatments and how they can also work on the main root of their problem at the same time and hopefully move forward from it in hopes that one day they will be symptom-free without invasive medication. And here are my references on these final 2 slides. And finally, I will open up the floor for discussion and questions. If you have any questions at all, leave them in the comment for me and I will get back to you. I want to thank everybody for listening to my presentation. Hopefully one day we can look at this picture of the Western and alternative tilting and hopefully that it will be level and they will work together.